Hello, people, and welcome to the second edition of the Labour Future podcast. We're delighted to be back this week. We haven't been taken off air in our first week, which is a triumph. Before I introduce our first guest, can I just say thank you to everyone for the comments, for the interactions and the discussions that took place last week. We received a little bit of criticism over our commentary on the Brexit position, but I think we did discuss it. But thank you anyway, and we were delighted that we only got thumbs up and love hearts. Keep them coming. We don't want any angry faces or any thumbs down ones. We'll block you if you do. No, we won't, because we believe in democracy and discussion. I'm Brendan Chilton. Joining me again this week is Jervis from the English Labour Network, and today we have a very, very special guest on our show. The man is a legend. We have Dr Martin Ebodor, who is a GP and who stood. He's here, he's waving at you now. Wave, Martin. There he is.
Hello.
He stood against Priti Patel, the Home Secretary in the Witham constituency in Essex in the last election. And today we're going to be talking about coronavirus and the NHS. We're going to delve into the inquiry, or the investigation rather, into the BAME problem at the moment with the number of people contracting the deadly disease. And we're going to be talking as well about the last general election and the lessons we can learn from campaigning in Essex. So welcome, gents. Let's crack on. Martin, straight over to you. Tell us,
Hello, Martin.
What's it like? Hello, Martin. Sorry, Joe, I shouldn't have been reading this script, trying to talk to three people. Martin, just tell us, what's it like right now? You're a GP, you're on the front line, you're dealing with patients every day. Give us your experiences. What's it like?
Yeah, so first of all, thank you for having me on the podcast, Brendan. It's an absolute pleasure to be here with you guys. So I'm a GP working in East London in one of the most diverse populations in the UK, Newham. And I have to be honest with you, it's very, very tough right now. Coronavirus is a pandemic affecting all aspects of healthcare at the moment, from primary care to secondary care. The three main challenges at the moment, first of all, there's a challenge in terms of resources. As you're probably aware, for many months now, they've been a real problem with PPE supplies, personal protective equipment, getting to the front line. Many GP practices, hospitals have had to resource to sourcing their own, either making it, themselves or even ordering it themselves as well. The second issue we have is the care home epidemic. We're finding that elderly people in care homes have been negatively affected by this virus. Many people in care homes, people's grandmothers, parents are dying because of coronavirus, and the government has been really slow to act. The third aspect of this has been the workforce challenges within primary care. When the coronavirus pandemic first occurred, lots of my colleagues contracted the virus themselves. In my particular case, sadly, at my GP practice, our managing partner died as a result of contracting COVID-19. And as you can imagine, this has had a huge effect on healthcare staff, from nurses to porters to cleaners. This has affected us directly. We are losing colleagues, we are losing family, and we are losing friends. So it's been very, very tough, Brendan. And luckily, we've had lots of advocates in Parliament, especially on the Labour benches, speaking out on the issue of PPE, which has been really, really helpful. So, day to day it's difficult, but my colleagues in NHS have pulled together a huge amount. There's been a lot of innovation in primary care. We've changed the way we've approached consultations. We're now doing video and virtual consultations. And even though we can't see patients in the same way, face to face, in the general practice, we're still reaching out to our patients. We're still calling them and letting them know that we are here and we are open.
Martin, that's in many ways a harrowing account, really, of what it's like. I mean, for that, Joe, I know you haven't had it, Joe, have you? I certainly haven't. We've been at home. But when you hear these stories of people on the front line, it's ghastly. Can I just ask you, have you got, and have your colleagues got, the PPE equipment that we're hearing so much about? Have you got it? Because the government are putting all these stories out saying it's because the NHS is stockpiling it and not using it and all this sort of stuff. Have you got the equipment you need to do your job safely?
So right now in my GP practice, we do have the PPE. That's because of the excellent work of my senior colleagues. I can say his name. Dr. Nackley, who's also chair of Newham CCG, has worked tirelessly to ensure that GP practices in Newham have the PPE they need. That cannot be said for other practices or other hospitals elsewhere around the country. As you're probably well aware, Brendan, nursing homes, other hospitals, frontline staff, bus drivers continue to this day to complain about not having the protective equipment they need.
I mean, it's amazing, really. I think you said there, as you were just saying, that your hospital is having to source its own and in some case manufacture its own equipment. I mean, how can it be that in what are we, we're the fifth richest country in the world? We're in a situation where, I mean, you've read accounts around the country of where students in colleges are using their design and technology departments to make this stuff. I mean, it's absolutely extraordinary. Can I just ask you, I mean, you go out to work every morning, you go into the hospital, you're dealing with people. I mean, what is it like knowing that you're going somewhere where you could potentially, God forbid you don't, but get this virus and sadly, like your colleagues, become either extremely ill or pass away? I mean, that must be something really tough to grasp, that you're putting yourself in that position.
Yes, Brendan, it's extremely tough. In my case, I work in a general practice. We're currently doing very limited amount of face-to-face appointments. However, for some of my secondary care colleagues, that is the risk that they're taking. I also want to highlight that other key workers, such as hospital cleaners, hospital porters, nurses, bus drivers, they're going out day to day, putting themselves in the firing line to keep our services going. So, thousands, hundreds of thousands of workers, key workers out there, day in, day out, are putting themselves on the line so our country can keep going. And it's important that we recognize that. You're absolutely right, Brendan.
And Martin, if I could just jump in, what's the biggest worry at the moment? Obviously, we know cases are falling, thankfully at last, and so the number of deaths. What are the main asks at this moment in time? Is it still PPE? Is it? I mean, we know that the testing, they say, is there, but it's not being used. What are the main kind of concerns at the moment?
So, Joe, the main concerns are threefold. One, in which you refer to testing, is still a huge issue. The government, had this huge target of 100,000, but there are still reports that key workers, especially workers and carers working in nursing homes, aren't having access to the testing they require. The second thing is PPE still remains a huge concern, and that's the lack of PPE, not only for hospital workers, but we're talking about also for care workers, also for bus drivers, for key workers who are interacting with the public. And the third concern, that a lot of us in primary care have is the exit strategy and how the government is approaching it. Currently, England is taking a very different approach to Wales, to Scotland, and to Northern Ireland. We're easing things a bit more earlier than Scotland, Wales, and Northern Ireland. However, we're not testing as much, or we're not, tracing as much. So I and lots of my colleagues have a real worry around that. Comparable to the responses from other European nations, our government was very slow to act initially in regards to instilling a lockdown, which I think had an effect. We have to remember that as of today, we have the highest rate of deaths in Europe, the second highest in the world, second to the US. That is not a good record. That is something that the government cannot celebrate. So, we need to be truthful that the government response has been inadequate. We have to recognize that this pandemic is a crisis like no other. We've not seen anything like this in peacetime. So, it's understandable that the government found certain difficulty, but we can't deny that they were slow to respond initially, and the fact that we're not testing enough, we don't have enough PPE, we don't have the tracking and tracing approach that other countries are taking. It's something that we need to be vocal about, and we need to question the government. Why are we not responding in a similar way to Germany, in a similar way to Ireland? Surely something wrong has occurred.
Sure. And in terms of coming out of lockdown now, I mean, there's this argument, isn't there, between, the kind of mental health of the nation versus preventing the spread of the virus. Do you think that the balance of that is right? I mean, there was a stay alert messaging last week, which has been heavily criticised. But obviously the government wants to get the economy back up and running. And obviously, like I said, there's a question of people being stuck in their homes and those mental health concerns. Do you think it is right to ease lockdown? In England, we're talking about, me and Brendan talked last week about how it's very different in the four nations, but in England they have had to try and ease that lockdown. Is that the right thing to do?
Joe, the government has continued to say that that they're following the science on this. To me, I want to see that science. They've been very reluctant to make that public. I am a bit concerned that we're taking a different approach to Scotland, to Wales, and to Northern Ireland. One of the things that we must not do is allow this virus to re-emerge. The government refers to the R number. That's the rate of replication, how many people the virus can spread to from one infected individual. They're stating clearly that they want to ensure that number is below 1, but we can see, and evidence shows that actually that number is nearing 1 at the moment, but the government is easing the lockdown. We have to ask the question, why is that the case? Are we taking the right approach? For me, I am truly concerned that we are not tracking, we are not tracing, we're not having a right surveillance that's required if we wish to ease the lockdown. You raise a very good question about well-being versus the economy. One thing that we have to reflect on is that, health is a social good. One of the main priorities of government is to ensure that the public is safe. Therefore, when it comes to this debate about health versus the economy, for me, it's a no-brainer. You want to keep the public safe, you want to keep them healthy. We should only reopen the economy when it's safe to do so. And that is something that I believe, and that's something I'll continue voicing, because there's no point reopening the economy if it's going to lead to thousands more deaths.
I mean, you mentioned that your borough that you serve, your clinical commissioning group, is one of the most diverse in the country. I think you said Newham was the area you serve. I mean, we know that right now this virus is having a disproportionate impact on people from BAME communities. I think the statistics were Black and Indian people are much more likely to get it, but for some reason Bangladeshi people are lower to get it. Labour have asked Baroness Doreen Lawrence, whose son we all remember was tragically murdered some years ago, to lead an inquiry into this. And I just wonder, BAME people make up around 45% of the NHS workforce. What do you think the scope of that inquiry should be? And do you have any observations or comments you'd like to make as a medical professional on that?
Yeah, so Brendan, first of all, I was very, very happy to see Keir Starmer appoint Doreen Lawrence to lead a inquiry review from a Labour end. I think it's absolutely needed. You are right. The statistics are worrying. The Office of National Statistics a few weeks ago revealed that if you are a Black male, you are 4 times more likely to die as a result of contracting COVID compared to Caucasian counterparts. This is a statistic that we cannot ignore. And I've actually joined a coalition of other BAME public figures in writing a letter to David Cameron demanding an independent public inquiry into Black, Asian, minority, ethnic deaths as a result of COVID. The government has announced a review spearheaded by Public Health England. We're saying that's not enough. We need an independent inquiry led outside government to produce figures which we can then and produce results which we can then act on to rectify. What we're seeing is a highlight of the social, economic, and health inequalities that have always existed, but COVID has brought to the forefront. We need a deep dive to truly understand the scope of what's going on. And I and many others believe that an independent public inquiry is required.
I suppose one of the things we should consider, I mean, do you have any thoughts as to why?
Yeah, so there are multiple potential contributing factors. The first factor that can possibly explain this is that initially we saw the concentration of COVID cases occurring in large metropolitan areas like London, where ethnic minority communities are largely represented to a high percentage. The second thing is that a lot of ethnic minority communities, we find that certain chronic diseases like diabetes and hypertension are more prevalent, for example. And we know that those who contract and develop COVID, those who are more likely to die from COVID are those with pre-existing chronic health conditions. The third aspect of this is the fact that among key workers, Black, Asian, and minority ethnic people are, overrepresented. For example, among care staff, among nurses, among bus drivers, for example. And we find that a lot of those individuals have been contracting COVID as at a higher rate than the general population. But, it goes deeper than that. We're talking about structural inequality within our society, and we need to really get to the root of why is that the case. I wouldn't like to preempt any inquiry or investigation, but that's, that would be the purpose of looking into this in an independent, quantitative and qualitative manner. What I believe is that post COVID-19, post this crisis, we need a new consensus on how we treat care workers, a new consensus on the way we approach health and social inequality, a new consensus on the way we fund and support our healthcare system. We can't go back to business as usual.
Well, Martin, we've dealt with some very heavy issues there, and the impact of the virus on particular communities and the pressures on the NHS. And I think we're going to have you back on at some point if you're willing, as we get more information about this, because it's a huge subject, and we know many Labour members up and down the country have been affected by this, and the pressures on the public services are immense. But I want to turn now, if I may, to your experiences as a candidate in Essex, that great socialist territory out there. As we mentioned, you stood against Priti Patel. Just, that was tough, I imagine. I mean, she's got 30,000 majority, something like that. They weigh the Tory vote there. So what was it like? Tell us.
So first of all, it was an absolute honour and privilege to be the parliamentary candidate for Witham. It's a great area. They have a very vibrant Labour club there, despite the Tory majority. I have to give a huge shout out to my agent Pete, and also Eileen, who's a phenomenal activist as well. It was a tough election, I have to admit. The Labour message was not resonating on the doorstep. There was a big issue with Jeremy Corbyn and his leadership. And that's something we can't ignore. But I enjoyed trying to get the Labour message out there. I enjoyed stumping the pavement. That was a fun experience, to say the least. So it was a difficult few weeks. I did have a few doors closed on me, but people were interested in speaking, and it was great to just engage in democracy. Obviously, the results, we know about that. That's history now. One thing that we have to do going forward is learn from the past, listen. One thing about Essex and campaigning in Essex, it's very different, from North London. People have a different perspective and worldview, and it's important to respect that. And it's important to listen to people and actively listen. I'm very confident, with Keir Starmer as a new leader, we're going to start listening But we have a huge journey, a huge task in terms of reconnecting with our electoral base. And the only way we can do that is by showing them that we do take their concerns seriously.
Martin, what were you hearing on the doorstep, and what were the reasons people who weren't voting Labour, which was obviously the majority in that kind of area, who were, what were the key messages they were giving about the Labour Party?
So in terms of the key message, one of the major concerns was that people did not think we were patriotic. They didn't think that we cared deeply for England. They didn't think that we actually cared about their national security. They were concerned about the leadership's foreign policy approaches, and they didn't believe that we would meet the aims of our manifesto. They liked many aspects of our manifesto, but they didn't think we would achieve it. So there was a huge concern about our credibility, about the worldview of the leader, and also about whether our party spoke for them.
It's interesting. I mean, could you say if you had the leader of the Labour Party sitting right here now, what would you say to him as the sort of the top 2-3 things we need to do in terms of policy to win back those very people you were just describing?
Brendan, absolutely fantastic question. In terms of the kind of 3 things I think can be taken is, first of all, it's explaining to people that actually the Labour Party is patriotic, that we do believe in the United Kingdom. We do also believe, we do respect the traditions of kind of the UK. The second is really stating to them that, we want to help and support them to kind of thrive, to achieve their goals and dreams as well. And the third thing is, around credibility. And the way you gain credibility is about, explaining how exactly you will achieve your aims. So we just need to be clearer with any future manifesto we have about how we plan to deliver on the promises.
Martin, you and I have mentioned immigration in the past, and we all recognise the incredible contributions that immigrants have made to our country, and I think we all want to have as liberal an immigration policy as possible. But I mean, did that come up on the doorstep at all in terms of Labour's full-on commitment to free movement? Is that something that we need to look at again? I mean, yesterday we had the second reading of the immigration bill. I think Yvette Cooper very bravely stood up and I think she I don't think she voted for it.
I think she abstained.
She abstained, did she? Yeah. So she abstained on that, and she got an awful lot of abuse. But I just wanted your views on whether the Labour Party needs to go. Do we need to get behind a position of managed migration, or do we stick with our free movement policy from last time around?
I think as a party, we first of all have to kind of reflect on our current position. So a lot of the debate internally within our party around immigration is wound up in the wider Brexit debate and discussion. I think we need to first of all acknowledge that the debate over Brexit and the debate over free movement is over, in the sense that we will be leaving the European Union, or we've left the European Union, and our country will now have to decide what sorts of immigration policy we'll have. And as we can see with the immigration bill, the Tories are now molding that in their own image. What we have to do as a party now is have a discussion with the public and actually say what we feel the right immigration policy would be. And I believe that would be a policy that is fair, equitable, and the public has a buy-in. And in my view, that would be a form of managed migration. But that's acknowledging where we are in the current debate, acknowledging where the country is, and also trying to mold any future immigration policy in a progressive way. So, that would be my view. It involves having a real discussion within a party, but also having a discussion with the wider public and taking the public with us. We can't go back to the debates of the past. We can't go back to the Brexit debate. We can't go back there because, the country has moved forward. And that's my view.
Absolutely, yeah. And we have, of course, managed migration with the whole world other than the EU. So the idea that it's against our values somehow, it's always seemed a strange one to me. I campaigned in a seat relatively close to yours on the edge of Essex, Thurrock, and I also campaigned in Dagenham and elsewhere. And the things coming up on the doorstep, it wasn't migration specifically, but there was certainly a sense of the Get Brexit Done slogan, and I think wrapped up in that was taking back control of our borders. So it's interesting to hear you say that, having campaigned in Witham, and possibly maybe the Labour Party will move in that position over the next year or two. But I think obviously we need to take party members with us, and I think there are debates to be had around that.
Definitely. Martin, can I just ask you, can you just say where people can find you on Twitter if they want to follow you and follow your work?
Yeah, so I'm on Twitter at Martin Ebodor, Edobor, just my name. And I tweet often, so if you want to tweet at me, go ahead. We can have a discussion and debate. And
what we'll do, Martin, we'll put your hashtag on here so people can your handle. Sorry, been out in the sun too much today. I'll put your handle on here so what we can do, people can follow you and we can share this with you. I just want to say a massive thank you for coming on. And I mean, when's your next shift? Yeah. I'm assuming you're back this week at the GP surgery.
Yeah, back at work tomorrow, so that should be fun. Love serving the community.
Thanks very much, Martin. Great to have you on. And see you again soon, and best of luck with your work on the front line.
Awesome. Thank you for having me, and great work on the podcast. Really enjoying it.
Cheers.
Thank you, mate. And to all our listeners and to all our viewers, which are going up by the day, stay safe, wash your hands, stay at home.